Hello, and thank you all for joining us today. My name is Mia Cifuentes, Research Assistant. Today we're going to talk about what to do during a heart emergency. We're going to focus on three common heart or cardiovascular emergencies: heart attack, stroke, and hypertensive crisis. To begin, let's picture the heart and blood vessels as our own system of roads with traffic running 24 hours a day. The blood traveling through these roads delivers oxygen and nutrients to all the organs and tissues in our body. It also picks up carbon dioxide and waste. The heart keeps the traffic flowing by operating as a pump. Over time, the roads of the blood vessels can become damaged from years of traffic. Some changes are related to aging, but diseases can also speed up and add to the damage. High blood pressure weakens the roads due to too much traffic. High blood sugar and high cholesterol can also lead to road damage. The first cardiovascular emergency we'll talk about are heart attacks and myocardial infarctions. The heart muscle helps deliver blood to the organs and tissues, but it also requires its own blood supply to work. A heart attack occurs when blood flow to the heart is suddenly blocked off. Heart muscle does not grow back, so acting quickly to get to the emergency room when symptoms of heart attack develop is very important. Sometimes a heart attack is the first sign of cardiovascular disease. Signs and symptoms of heart attacks can vary. Major symptoms are chest pain or discomfort that is unrelieved by rest, nausea, feeling lightheaded or unusually tired, pain or discomfort in the jaw, neck, or back, pain or discomfort in the arm or shoulder, shortness of breath. Women and older adults might have different signs and symptoms of a heart attack than those that are usually seen in men. For example, abdominal pain, back pain, and fatigue. What should you do if I think that someone is having a heart attack? Call 911. Do not hesitate even if the person tries to convince you that the problem is minor. Time is very important. Time lost can be heart muscle lost. Remember, time is muscle. Do not leave the person alone. Let's take a look at the chain of survival at the bottom of the heart attack handout. If the person is awake and aware of their surroundings, you should reassure them that help is on their way, try to create a calm environment, help them to sit or lie down. If the person is unconscious, you should follow the instructions from the dispatcher, administer CPR if you or someone else is trained to do so, if an automatic external defibrillator machine is available. Ask someone to get it while you stay with the person, or you get it while someone stays with the person. Just make sure someone is always with the person. Follow all directions from the AED machine. Now, we will talk about how to recognize and respond to a stroke. Stroke or brain attack is also caused by problems in the roadways of the vascular system to the brain, similar to the heart attacks, and have many of the same risk factors. Like heart attacks, acting quickly is very important. Time is brain. Brain cells die each minute you wait to call 911. There are two types of strokes: those that are caused by a clot or blockage that prevents blood getting to the brain, those that are caused by a brain bleed or leaky or broken blood vessel. The symptoms of a stroke usually correspond with the part of the brain that is affected. Onset of symptoms are sudden and may include numbness or weakness in the face, arm, or leg, especially if it is one-sided, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, trouble with walking and coordination, dizziness, or loss of balance. The person may appear drunk. Severe headache without a cause. If you think that someone is having a stroke, call 911 immediately and use the FAST test. F, face. Ask the person to smile. Does one side of the face droop? A, arms. Ask the person to raise both arms. Does one arm drift downward? S, speech. Ask the person to repeat a simple phrase such as, "The dog is brown." Is their speech slurred or strange? T, time. If you observe any of these signs, call 911 immediately. Note that the time of the symptoms started, because the quicker the medical team arrives, the better chance for a good outcome for the person having the stroke will be. Now we will learn about how to recognize and respond to a sudden increase and highly elevated blood pressure. This is called a hypertensive crisis. A hypertensive crisis is a severe increase of blood pressure, more than 180 systolic, top number, or 120 diastolic, bottom number. This highly elevated blood pressure damages the roads of the vascular system and can lead to a stroke, heart attack, or organ damage. This is why it is so important to know what your baseline blood pressure is and to control high blood pressure. If you take your blood pressure and get a reading of 180 over 120 or higher and are experiencing any of these symptoms, chest pain, shortness of breath, back pain, numbness, weakness, changes in vision, difficulty speaking or confusion, dizziness, or vomiting, this is a hypertensive emergency. Call 911 immediately. What should you do if your blood pressure is 180 over 120 and you do not have any symptoms? Wait at least 2 minutes and recheck your blood pressure. If it is as high as the first reading, check for the presence of new symptoms. If any new symptoms we mentioned before appear, call 911. If you have no symptoms associated with the high blood pressure or if blood pressure goes down, this is considered hypertensive urgency. Call your healthcare provider as soon as you can to report the high blood pressure. Let's wrap things up. Today, we learned about life-threatening emergency situations involving the cardiovascular system, heart attacks, strokes, and very high blood pressure. We walked through how to recognize symptoms for these emergencies and the importance of acting quickly. The faster the person gets help, reduces the risk, complications, and death. If you have any concerns about your health or symptoms that you are having, contact your healthcare provider. Thank you everyone for your time today.